So welcome back to yet another session, guys. Here in this session we will be talking about the NACO program, right? So NACO is your NACO, or you can call that as NACP as well. So this is your National AIDS Control Organization, right? So NACP program, actually National AIDS Control Program, is actually governing under the NACO program, that is the National AIDS Control Organization, right? So let's talk about this program, guys. So NACO, this is the symbol of NACO, right? You must have seen that at several places. So that ribbon over here is showing the AIDS sign over here, right? So guys, here this is the NACO. NACO NACO stands for National AIDS Control Organization, right? And this is the symbol, this is the logo, and it is governing under the Ministry of Health and Family Welfare, right? So that you need to know about that. So under this one, we are talking about the Sankalak, right? Sankalak, that is the status of National AIDS response. Okay, that might be asked. So status of National AIDS response, that is talking about the Sankalak under the NACO program only. You can see that this is under the NACO program, right? So what is Mission Sampark, right? So let's talk about some of those salient points over here which shall be tested. So what is Mission Sampark in this NACO program? Mission Sampark is simply telling that what about the follow-up cases of the HIV, right? So it is to ensure the follow-up cases of HIV, who are on antiretroviral therapy, right? You know that for the HIV we are giving the antiretroviral therapy, right? Okay, so that is about the Mission Sampark, right? Now some of the factual data, some of the data which shall be asked from the examiners, right? Let's talk about that data as well. For an example, the first one, that what is the prevalence of HIV in India? Now prevalence of HIV in India I am talking about, that is around 0.22%, right? 0.22%. Second point over here, what about the HIV patients in India? HIV patients in India are about 23.5 lakhs, but that is kind of a vague number. Obviously they will be increasing. 70,000 new patients are coming every year as far as HIV is concerned. New cases every year are registered. The first case of HIV was discovered in the 1985-1986 time, and that is not the very old disease HIV, right? Until now we are not having a permanent method that we can say that yes, we can cure the HIV by this particular drugs, right? We are talking about the progression of the HIV, but not the elimination of the HIV, right? That is the thing over here. As far as antiretroviral drugs are concerned, yes, antiretroviral drugs must be taken from the patient as soon as possible as they have diagnosed, and our purpose is to diagnose the patients as soon as possible, right? Because if the disease will be progressing in the patient, then obviously it will be much harder for the patient to survive in the coming time, right? So that is the thing over here. So we shall be slowing down the progression of the HIV in the patient, but we shall not say that we are killing the HIV permanently in the patient. That shall not be guaranteed by these antiretroviral drugs, right? But still we are working on this, right? And a lot of things are actually yet to be discovered about the HIV treatment, right? So over here we shall be talking about the HIV sentinel surveillance, guys. So let's talk about that HIV sentinel surveillance. What is that, right? HIV sentinel surveillance means that usually if you are talking about the blood donation and all of those things, for that purpose, right, HIV sentinel surveillance means that you are surveillancing the drug, surveillancing the blood actually for the HIV, right? So basically if you are giving the blood, right, then they shall be running some test over it, and one of the test will be the HIV test also. So that is for the screening purpose, right? So that is the thing about the HIV sentinel surveillance, nothing else. So they have divided 3 groups over here, right? One group is the high risk population, one group could be the high risk population, one group could be the bridge population. I will be talking about what are they, bridge population, and another group could be the mothers. They are the pregnant mothers, ANC mothers, right? Antenatal care mothers. Okay, so let's just talk about them. What are they? In the high risk group people, right, we are talking about, for example, sex workers. That they are the high risk people, right? And probably the anal sex, right? That is actually increasing the chances of transmission of the HIV, right? Okay, then the IV drug users, yes, no doubt in that IV drug users shall be transmitting this HIV over there, right? Then transgenders and all of these things, transgenders, right, and all of these things. So these could be things. So for that purpose, there should be the opt-in testing. Opt-in testing means you will be taking the written consent of the person that you are checking the blood for the HIV testing purpose, right? So that is the opt-in testing over here. So you will be checking for the opt-in. You will be going for the opt-in testing, right? Then let's talk about the next one, that is the bridge population. Here we are talking about the long distance truck drivers and all, right? So truck drivers, right? Truck drivers, migrant workers, right? These can be the examples under the bridge population. ANC mother, you know the example already, that we are talking about the pregnant female, right? Just before the birth, before the birth, during the pregnancy period and all, right? So here we are running some test over here. What kind of test we are running over here? Let's talk about them as well. So we are running the test like HIV. We are running the test like hepatitis B, right? We are running the test like hepatitis C. When you will be working in the gynae department, right, for a posting purpose or for the internship purpose or something else, or for the residency purpose, then at that point of time you will be seeing that you will be running the test, right? HIV test, you will be checking for the HIV test, hepatitis B test, hepatitis C test, you will be checking the syphilis test, that is the VDRL test, you will be checking for the malaria, right? All of these things, so that we are knowing that this particular female is not having this particular thing, right? So we are ruling out these diseases from that particular female at first place, right? And this is the opt-out testing. The opt-out testing means that formally will be taking, informally will be taking, oral consent will be taking from the mother, that we will be checking your blood for these kind of things, right? And here this will be the opt-in testing again, right? For the bridge population, will be going for the opt-in testing again, right? Now we shall be categorizing our patient according to the severity, right? The areas, right? So what do I mean by that? We'll be calling the first group of people, I'm just writing over here, that they will be the highly endemic, right? There are some areas where the HIV is actually more as compared to the different area, right? So this area might be having the more HIV patient and as compared to this area, right? So group A, the population A might be having the more HIV patient as compared to the population B. So like that I am comparing over here. So highly endemic areas or the highly prevalence areas, okay, what areas will be called as these kind of areas? So we will be calling those areas highly endemic areas where the HIV in ANC mothers, right, they are more than or equal to 1%, right? And HIV in the high risk group people, that is more than or equal to 5%, those kind of people, those kind of areas will be called as the highly endemic or the highly prevalence disease areas, right? Second one which we shall talk about over here, that is the moderate prevalence areas or the moderate endemic areas, or the moderate prevalence areas, right? So here we shall say that HIV in the ANC female, would be lesser than or equal to 1%, and HIV in the high risk group people, it will be more than or equal to 5%, that will be same as the highly endemic areas. But here we are seeing that HIV in the ANC mothers are actually reducing, that is lesser than or equal to 1%, right? So third one which we shall talk about over here, that these are the low endemic areas or the low prevalent areas, right? So here we shall be talking about that HIV in the ANC female will be reducing lesser than or equal to 1%, and HIV in the high risk group people are also decreasing over here, that is less than or equal to 5%, right? Then we shall be talking about the fourth category, that is the last one, that is the very low, that is the very low endemic areas or the very low prevalent area or very low prevalence is there as far as HIV is concerned. So here obviously the HIV will be reducing, so HIV in the ANC females will be lesser than 1%, and HIV in the high risk group people, that is lesser than or equal to 5%, and they are not having without any kind of hotspots, they are not having the hotspots as well, right? Okay, so that is the thing about the very low endemic areas. This is about what? This is about the categories, right? You shall be dividing the people into the categories, right? This population, the population we shall be dividing the categories, right? This population might be the highly endemic or moderately or low or very low according to this classification, right? Okay. Now please remember that sex clinic or sex attendants, right, they are not included in the HIV sentinel surveillance, right? So sex clinics are not included. Sex clinics are not included in the HIV sentinel surveillance, which I have talked about, right? HIV sentinel surveillance. So there also I have talked about the ANC mothers, I have talked about the high risk group people, I have talked about the bridge population, but not the sex workers and all, right? So please do remember that. Now then we shall be talking about the Suraksha clinic, right? Suraksha clinic. So recently the MCQs was asked regarding the logo for the Suraksha clinic. This is the logo for the Suraksha clinic, which is talking about the sexual and the reproductive health services, right? So this is the logo for the Suraksha clinic. Please do remember that. And Suraksha clinic is talking about the STI patient, I mean the sexually transmitted disease patient or the reproductive tract disease patient. They are talking about that. So this is for the sexually transmitted infection patients or the reproductive tract diseases patient, right? This is the government facilitated private hospitals. This is the government facilitated private hospitals, right? So that the people reach out over there, and this is the government facility only. These are the Suraksha clinic, right? Opened by this is the initiative from the government side. Okay. Then we shall be talking about the kits. They are very, very important, guys. Please do remember them. So we shall be talking about the syndromic management of the sexually transmitted disease, right? And Suraksha clinic is about the sexually transmitted disease. So here these kind of kits might be provided by the Suraksha clinic also, right? So these kind of kits might be provided from them. So what are these kits? So here in total we are having the 6 kits, right? 6 kits are present over there. So kit 1 is talking about the gray, right? Kit 1 is the gray over here, right? So first kit is the gray color kit, second kit is the green, third one is the white color, fourth is blue, fifth one is red, sixth one is yellow, and right, and the seventh one over here would be the black color category, right? So kit, this is the 7 category. So we are having the 7 kits over here, right? So this will be the 7, right? 7 kits. Okay. So how many kits we are having, guys? We are having the 7 kits. Okay. So 7th one is the black. So first thing is that you need to remember these kits, right? Second thing is that what are the drugs we are giving in that, right? For example, you can see that tablet azithromycin 1 gram 1 tablet and tablet cefixime 400 mg 1 tablet will be given in the gray kit, and they are talking about what? They are talking about the urethritis or the cervicitis, right? So urethral or anorectal discharge or the cervical discharge or the urethritis cervicitis. In this case, we are giving the azithromycin and the cefixime. Azithromycin will be given, that is 1 gram 1 tablet, and 400 mg 1 tablet will be given for the cefixime in the gray color category. That is the kit number 1. Kit number 2 is talking about the green color category, where we are giving the secnidazole, that is 2 gram. Okay, that will be given 1 tablet, and 1 tablet of the fluconazole, that will be the 150 mg, and that is included in the green category. Here we are giving that for the vaginal discharge or the vaginitis. For the non-herpetic genital ulcer disease, we are introducing the third kit. In the third kit, this is the white color category, right? White color category, and in every kit there is a sign of NACO, because this is a NACO program only, and it is coming under the NACO program only. So here we are giving the benzothine penicillin 2.5 milliunits over here, 1 vial plus tab, right? 1 vial plus tablet azithromycin 1 gram, right? So kit is also containing the 10 ml of disposable syringe and the 21 gauge needle. 1 vial of 10 ml sterile water will also be provided in the kit itself, right? Then we talk about the fourth kit, that is for the genital ulcer disease or the non-herpetic one, right? Here the patient which is allergic to the penicillin, right? So over here we are talking about the drug, that is the doxycycline 100 mg 1 tablet BD for 14 days, and azithro 1 mg 1 tablet, right? That will be included in the blue color category. That is the kit number 4. Kit number 5 is talking about the red color category, where they are talking about the antiviral drug, that is the acyclovir 400 mg will be given TDS for 7 days. 1 tablet we are giving 3 times in a day for 1 week, right? And that is for the genital ulcer disease, that is herpetic, because herpes is basically usually the HSV2 is causing that particular thing. So HSV herpes is the viral infection, that's why antiviral is this one, right? So they might be giving you the case that the patient is suffering from the herpes, and you shall be giving which kit over here, or they shall be asking you which color kit you shall be giving over here. So that is very, very important for the MCQ purpose. Please do remember that, guys. So kit number 6 is about the yellow color, where we are giving the cefixime 400 mg 1 tablet, metronidazole 400 mg 1 tablet for 14 days. For 2 weeks you are giving, and doxycycline you are giving for again 2 weeks over here. That is for the lower abdominal pain and usually the PID, that is the pelvic inflammatory disease, right? And which color you are using yet, which color we are using, guys? That is the yellow color category, right? And the kit number 7, that is for the inguinal bubo, right? That is the black color. That is the black color. Here we are using the doxycycline 100 mg BD for 21 days, azithromycin 1 gram, 1 tablet, right? So that is again the black color. Here we are using the doxycycline and the azithromycin. So usually very commonly azithromycin is used in most of the kits, right? Azithromycin, you can see we are using it in the kit number 7, we are using the azithromycin in the kit number 3, we are using the azithromycin in the kit number 1 as well, right? And you can see the doxycycline role is also there in the kit number 4, kit number 6 and kit number 7. The doxycycline role is also there. So you can see that's how you can remember over here, right? And the color and the drugs and for what purpose you are using, very very important guys. This is very high yield. This is very high yield. I can't emphasize it enough how important it is. This is very important guys, and it has been asked multiple times, right? Multiple times it has been asked in several examinations. So please do remember that. Now we shall be talking about antiretroviral therapy. And here we are having the centers. Under the NACO program, we are having the centers. You can see the National AIDS Control Program. Under this program, we are having the centers. In the healthcare center, the healthcare of country, healthcare of community, healthcare of India. In that chapter, I have talked about that. We are having, first of all, the basic level, we are having the PHC, then the CHC, then the sub-district hospital, then the district hospital, and then the tertiary care hospital. All of these things I have talked about over there, right? So here also at the very basic level, at the very first level, we are having the link ART centers, right? We are having the link ART centers, that is the antiretroviral therapy centers, and the link and the LAC plus centers, right? Here they are present at the sub-district level hospital and the CHC. They are present at sub-district level hospital and the CHC, and here they are providing the first generation antiretroviral therapy. I will talk about antiretroviral therapy, what drugs we are giving, for example. Then we are having the ART center. ART center is working at the level of medical college and the district level hospital, right? And in the ART center, what drugs we are giving over here? We are checking for the CD4 plus count, that is the thing. And we are giving the first generation ART with that. We are giving the first generation antiretroviral therapy as well, right? If we talk about the third one, we are talking about the medical college level. At the medical college level, we are talking about these things. We are talking about the CD4 plus count. We are doing that as well. We are giving the first generation ART. With that, we are giving the second generation ART as well, right? So both the generation of the ART will be given at the medical college level. So first of all, first generation ART will be given, then CD4 count and first generation ART shall be given at the medical college and the district level hospital, and at only the medical college hospital or the tertiary care hospital where we are talking about the ART plus. ART plus means first generation, second generation, both the generation ART shall be given, and with that CD4 count shall also be checked. COE is for Center of Excellence. That is the medical college usually, Center of Excellence, right? So that is about the 3-tier structure, that how the NACO has been under this program, how the HIV treatment is given over here, right? So CD4 count might be checked for the ART centers, antiretroviral therapy centers, and in the Center of Excellence, that might be checked. But at the PHC level, CD4 count shall not be checked. Only the ART will be given. First generation ART will be given, right? Okay, guys. Once we have talked about that, now we shall be talking about some drugs. As far as HIV is concerned, we are giving the antiretroviral therapy, and for different persons we are giving the different ones. For example, we are giving for the neonates also, we are giving for the children also, we are giving for the pregnant ladies also, and for the adults also. There are different guidelines are given over here, right? So for the adult women and the adolescents and the adult persons over here, we shall be giving the 3 drugs combination over here, right? TDF we are giving, that is the tenofovir, guys. TDF, which is the tenofovir. So I am just writing over here, guys, TDF. If I am saying, then it means that tenofovir, right? It means the tenofovir, right? Then if you talk about the 3TC, right? If you talk about the 3TC, then it means that we are giving the lamivudine. 3TC, we are giving the lamivudine, and they are talking about the DTG. It means that we are giving the dolutegravir. We are giving the dolutegravir, right? So that is the 3 drugs which we are giving over here. So that is the tenofovir, lamivudine, and dolutegravir, which is given over here, and this is the combination which is written over here in front of you guys, right? In detail, you will be studying that in the pharmacology classes as well. In detail, you will be studying that in the medicine class as well, right? Okay. Now, alternative drugs, efavirenz can be added. EFV is the efavirenz, right? EFV can be the efavirenz shall be added over here, right? Efavirenz shall be added over here as the alternate therapy. This is the recent one. This is the updated one, guys, which I am telling you, right? So over here, these drugs might be added, right? So once you talked about that, okay, you shall be going through that, okay, and you shall be correlating it with your medicine and the pharmacology classes as well as far as ART is concerned, right. So this is the scheme which you need to remember for that purpose, right. Now we shall be talking about the pre-exposure prophylaxis, guys. Now let's talk about the pre-exposure prophylaxis, right, and after that we'll be talking about the pro-exposure prophylaxis as well, right. Pre-exposure means till now the patient has not been exposed, right. So what will be doing in this particular case, right, for the prophylaxis purpose. So 2 pills can be given, right, 2 pills can be given between the 2 to 24 hours before the intercourse. Before the intercourse, right, for example, some person is HIV, right, and different person is not HIV. For example, we are talking about the partners and all, right. 2 pills can be given, however, it can be risky, right. 100% protection is not mandatory over here, right. 100% protection shall not be given over here in this case. So 2 pills between 2 to 24 hours shall be taken before the intercourse over here or before the sex over here. Third pill will be taken 24 hours after the 2 pills. After 2 pills, third pill will be taken. So first pill will be taken 2 to 24 hours before the intercourse, right, and after that third pill might be taken after the 24 hours, right, of second pill, right. Then fourth pill might be taken after 48 hours, right. Fourth pill might be taken 48 hours after the first 2 pills, right, after the first 2 pills. So that is the thing over here. So third pill, so you took the first and second pill 2 to 24 the 2 to 24 hours before the intercourse. Then third pill you will be taking after 24 hours of that. Fourth pill you will be taking after 48 hours of those first 2 pills, right. So that is very clear. What drugs you will be taking over here, that is also important, right. So what drugs you might be for the pre-exposure prophylaxis they are using, then they are saying that they shall be using the tenofovir disoproxil fumarate, right, 300 mg shall be taken. Along with that they shall be taken the amtricitabine might be taken, that is 200 mg, right. So amtricitabine 200 mg and tenofovir disoproxil fumarate, that is 300 mg. The combination shall be taken, okay. I told you that first and second pill 2 to 24 hours before the intercourse, third pill after the 24 hours of the first 2 pills, and after the 48 hours of the first 2 pills, fourth pill might be taken. That is the pre-exposure prophylaxis, right. Now how to prevent the prevention of this particular transmission of HIV from the mother to the baby, right. So let's talk about that as well. So I am talking about the PPTCT, I mean the prevention of parent to child transmission, right. That means prevention of HIV, obviously, right, prevention of parent to child transmission, right. That is also very important for us. So let's talk about some of the points over here, right. So here I am just telling you PPTCT after the pre-exposure prophylaxis, right. So prevention of parent to child transmission, right. So here we need to check the all the ANC mothers. I told you what test we are running over there. We are running the test for the HIV, we are running the test for the hepatitis, we are running the test for the VDRL, right. So all of these things will be checking at one place. That is the thing. Now we will be testing all the ANC females for the HIV, and which testing, opt-in or opt-out testing. I told you the informal consent will be taken, generally the oral consent will be taken, right. We'll be starting the antiretroviral therapy, start the ART. I have talked about the ART, what ART we are using over there. ART in the first trimester only, and we will be giving it till the lifelong. So start the ART, start the antiretroviral therapy, right, even in first trimester, if she is having the HIV, right. For an example, if she is a HIV patient, so first trimester, and we will be continuing it till lifelong, right. C-section is not compulsory in this case. If we are thinking that the vaginal delivery might be transmitting the infection, that is not the case. C-section is not necessary every time. C-section will be done only if gynae complications are there. So C-section is not necessary in this case, just for the purpose of prevention, just for the sake of prevention purpose, just for the sake of transmission of HIV, vaginal delivery will be transmitting it. That is not the case, right. In developing countries, exclusive breastfeeding will be given for 6 months. So exclusive breastfeeding will be given for 6 months, breastfeeding for 6 months shall be given, right? And after that, complementary, after 6 months, complementary feed shall be added. After 6 months, complementary feeding shall be, complementary feed shall be added along with, shall be added, right, shall be added along with breastfeeding, along with breastfeeding, that shall be added, right? You must have studied that in the preventive pediatrics also, I have told you, and you must have studied that in the pediatrics chapter as well, right? So what shall be the treatment, what should be the treatment for the neonate if I talk about, right? Let's say there is a there is a birth happened, and for the prophylaxis purpose we need to give the treatment to the neonate as well, right? So what shall be the drugs which we shall talk about over here? We shall be giving the raltegravir, with that we shall be giving the lamivudine. So we are giving the combination of 3 drugs and the zidovudine, right? So these 3 drugs combination we shall be giving over here, right, for the prophylaxis for the neonate, right? Up to 6 weeks we shall be giving the, up to 6 weeks we shall be giving the prophylaxis for the TB as well. Isoniazid preventive therapy shall be given, isoniazid preventive therapy shall be given for that purpose as well, right? Okay, so that is the thing over here. So if in this case we shall be going for the P24 antigen test. 2 tests for the P24 antigen will be taken over here. If the tests are, if the both the tests are negative, then we don't need to start the ART in those patients, right? And if the tests are positive, then we shall be starting the ART therapy, right, according to the P24 antigen, right? You must have studied that in the microbiology classes as well. Confirmatory test will be done at the 6 months, right? Confirmatory test will be done at the 6 months over here, right? Okay, once we have talked about that, now we shall be talking about the post exposure prophylaxis, right? Now we shall be talking about the post exposure prophylaxis. Post exposure prophylaxis. So we have talked about the pre-exposure prophylaxis earlier, and now we shall be talking about the post-exposure prophylaxis, right? In the post-exposure prophylaxis, we shall be talking about the ART, obviously. So we need to start the ART straight away. Antiretroviral therapy will be starting. Okay, we should be starting it within 24 hours. Should be starting within 24 hours, but as soon as possible is preferred, right? Okay, then we shall be continuing it for 28 days. Right, let's say there was a needle stick injury, or let's say there was after the intercourse and all. Okay, in those cases, so blood test will be done after 3 months, right? Obviously, if you will be doing the blood test just after the exposure, obviously it will be coming negative only. So you should be waiting for some period of time. And what is the time? 3 months. And obviously you should be taking the post exposure prophylaxis over there. Okay, so we should not be taking the risk. For example, if there is a needle stick injury, in that case also we are not taking the risk, because obviously in cases of hepatitis infection, right, blood transfusion or needle stick injuries, right, due to that 30% chances are there for the hepatitis for the transmission, right, because it is bloodborne. And if you talk about the HIV, guys, about 5% chances are there for the transmission purpose. So it is not that high, but still, why to take risk? So better to take the prophylaxis over there, right? So for 28 days, we'll be taking the ART, right? So within 24 hours should be started, or as soon as possible, right? So blood test after the 3 months will be checking over here. In case if the blood test comes positive, though there could be the 2 chances. It could be the positive, or it could be the negative. It could be the positive, it could be the negative. In case if it comes positive, then then in that case obviously you should be going for the ART straight away. And if it is negative, then you shall be going for the confirmatory test. You shall be going for the confirmatory test after 6 months. Okay, so once after 3 months, if it is coming negative, then after 6 months you need to again go for the ART, right? If it is confirmatory after what? After the 6 months, right? And still, if it is after that, if it is again negative, then what you need to do is you need to stop the ART, right? You need to stop the ART, right? You need to stop the ART. right? In case if the confirmatory test after 6 months, if it is positive, in case if it is coming out to be positive, then in that case, if it is coming positive, then in that case, this ART will be given for lifelong, right? So ART has to be taken for lifelong in those cases where the test is becoming positive, right? So HIV positive patient has to taken the ART lifelong. I told you about the pregnant ladies also, there is no exception. They can start it in the first trimester itself and they shall be continuing it for the lifelong. Their neonate will be given the prophylaxis as well. Okay, so that is the thing about the post exposure prophylaxis, very simple, right? So guys, that was about the NACO program, right? I have tried to make it short so that the crisp points you will be grabbing it on for the exams, right? So please go through it and try to solve the MCQs, and best of luck for the exam. Thank you.